board-certified reproductive endocrinologist. I'm also a gay dad and a husband of 2 kids, and I've done 2 surrogacy journeys through 2 different agencies. So I've kind of lived this at this point, and I think, you know, the process of becoming a parent, while it's overwhelming to get started, it's amazing, and you guys will make it through. And I do want you to know it is the most successful family building pathway that's out there, because typically you're dealing with healthy sperm donors, young egg donors, and a proven gestational carrier, a woman who's been shown that her uterus is healthy to carry a baby. So I applaud all you guys for being here, and the process of where to start is something that I've actually written a few blogs about in some of the gays with kids and gay parents to be spaces. But you know, you can start with knowing you want to have a baby, right? But then how are you going to get there? So you're going to need an egg donor, you're going to need a gestational carrier, you're going to need an IVF clinic, and you're going to need lawyers, all right? So finding your own egg donor and finding your own gestational carrier is actually a little dicey. So usually you start with either the agency or the doctor's office. So I'm happy to be the first place that people start. Right now it's probably about 70-30, meaning about 30% of my initial consults are people who have not identified an agency yet. And that first consult is basically an hour either in person or on Skype, where we go through your medical histories, talk about what you're looking for in an egg donor, talking about the difference between the egg donor relationship and the gestational carrier relationship, then talking about in vitro fertilization and the concept of growing embryos and how many embryos to transfer. And then I usually make a plan about things that you guys need to do and things that we need to do, whether we're going to provide you with a list of agencies or so on, and then we let you go. And then my office gets back to you usually within a week and says, well, what do you need help with? And the way my office works is I have 8 people on a team. There's 2 donor egg nurse coordinators. There's 3 patient navigators. There's Beatrice from the finance department who helps you kind of navigate the costs. And then we have a dedicated medical assistant, and then we have 2 social workers that work on this team as well. So it's actually a pretty robust team, because we'll do more than 100 third-party cycles this year. Third-party meaning anyone using a donor egg cycle. So we're very kind of experienced in this space. And one of the things that I think that RMA of Connecticut is known for across all the tri-state area is our patient care. So we want to do a good job. And me personally, because I've gone through this process, and one of the reasons I entered this arena as far as like helping gay men conceive is because when I went to go do it, here I am, a board-certified reproductive endocrinologist, a medical director of an IVF clinic, and I was overwhelmed. I'm like, where to start? And not only the costs, but some of the decisions. And so we really try to take you through it and really try to give you kind of the perspective of what to do next. As far as, you know, I know we don't have a lot of time, so I'm happy to take some questions if you guys have questions, or I can talk more. So does anybody have anything that they really want to put out there in this smaller space rather than the big room?
Do you handle, what is your role in the egg donation?
So egg donors are either come from an agency or come from the clinic. So we have about 30 of our own egg donors. Our egg donors are what we call identity or lease donors, so they're not known. So in a small state like Connecticut and so on, since most of our donors are local, right now we haven't progressed to the point of being known. So if you want to use a known donor, we usually direct you out to one of the agencies that we work with. The role of the IVF clinic, just to be perfectly clear, is to medically screen your egg donor for infectious diseases, genetic history, drugs and alcohol, her ovarian reserve, is she going to give us enough eggs to make a successful pregnancy, and then to stimulate her, retrieve those eggs, right? The role of the IVF clinic in the gestational carrier process is to screen the gestational carrier medically, to look at her uterus, to look at her obstetrical histories, then prepare her uterus to receive these embryos that are created in the IVF laboratory. So as people kind of go through the process, I think you have to remember that the IVF laboratory is really the key to your success. So you want to make sure you go to an IVF clinic that has, you know, success rates that are well documented, which all those success rates are out there. There's a simple site it's called fertilitysuccessrates.com that you can kind of look up individual clinics on. So as far as the egg donors are concerned, so we have our own donors or we'll use agency donors. sometimes people come to us from some of the surrogacy agencies, and those agencies often have their own donor lists as well. I mean, I work with all the surrogacy agencies, and I also work with people who just start with us and kind of go from there. Does that answer your question?
Yeah.
Okay.
And then I would just say that, or follow up, do you have donor agencies that you specifically work with in the same way that you have surrogacy? Like you'll work with any surrogacy agency and then.
Well, there's certainly surrogacy agencies that we like and we have good experiences to, so we kind of direct you that way. And there's egg donor agencies that we like and we direct you to. I mean, if I get a referral from somebody, like a referral in from somebody that we haven't worked with or we haven't necessarily like had a great experience working with, and you came from them, I'm obviously going to work with them, and we're going to do everything we can. Some of it is some of the hurdles in us. Some of the agencies really do a good job in taking care of the intended fathers, and some of them don't. Right? So we're really want to be as helpful as possible. So we like the ones that are really involved, and so that's kind of where we kind of direct you towards. Any other questions? One of the things that I think is important to talk about is embryo testing. So embryo testing means taking a day 5 and 6 blastocysts, which is about 250 cells, and taking about 5 to 10 cells off, putting those cells in the bottom of a little well, and then sending those off to a testing laboratory and finding out that if the embryo has 46 chromosomes. So I have 46 chromosomes. I'm willing to guess that everybody in here has 46 chromosomes. Embryos that are either Down syndrome have 47 or end in miscarriage have 47 or 45, we're trying to pull out of the group. So I'm part of a larger RMA network that's now tested over 15,000 embryos. And it turns out you can have the most beautifully appearing embryos, but 20 to 30% of beautiful embryos are actually not chromosomally normal. So by doing embryo testing, you can further maximize your chances for pregnancy and basically maximize your chance for a healthy pregnancy. And the other thing that this lets us do is if a couple's interested in just transferring one embryo, it lets you maximize the individual pregnancy rate of just one embryo. So that's called comprehensive chromosome screening. And in my office, about somewhere around 30 to 40% of all our transfers are pre-screened embryos. The chance of harming the embryo is less than 1%. And this technology has actually won 4 prize papers at national meetings and has over 50 publications. So it's not anything that's necessarily, new. It's just the platform we use is the most validated platform. So we're happy to transfer 2 embryos at a time if people want to do that. Obviously, your carrier has to be willing to do that. It's interesting. A lot of the gestational carriers or surrogates I see now are only willing to do 1 embryo at a time. So you want to make sure you guys think about that. I mean, I can tell you that, having 1 baby at a time is kind of how we were meant to parent. Just, natural incidence of twins is only about 2%. The incidence of twins, if we transfer 2 embryos from a young donor, is about 40 to 50%. So the pluses of twins is you got pregnant with twins and maybe you're done, so to speak. Unfortunately, twins do have a higher risk for complications, so we would talk about that, but we're happy to transfer 2 embryos if people want to transfer 2 embryos. Yes, sir?
I've got a related question, which is my partner and I want to have a single only child.
Yeah.
What happens if you try several times and it still doesn't work? What happens financially at that point?
I was kind of passionate about encouraging people to feel like they have the space to do one. So we have basically 2 what we call opportunity plans out there. One of them basically you get 3 transfers for 1 cost. The other one you get unlimited transfers for 1 cost. In my opinion, in 3 transfers, 90% of people are going to be pregnant. And if you're not pregnant after 3 transfers, and we tested the embryo, there's only so many pieces of the puzzle. It's either sperm, uterus, or egg, right? So we usually end up changing the gestational carrier. So, which is a hard thing to do because this is a woman now you've done 3 transfers with, you're close with. But on her side, she doesn't want to be negative either. She doesn't want to go through this again. It's a hard process. So basically what we've done in my practice is we tried to take the pressure off a single embryo transfer, meaning we could basically give people 3 tries or unlimited tries if that's what they want. Other questions? And as far as, in the process, I think that it's always important that I've interestingly been hearing lately about the male biological clock. You shouldn't feel the pressure of timeline. And the reality is from this seat here, even if you went full speed ahead, it's going to take you 18 to 24 months to have that baby in your arms. So take the time, whether you take another 2 months or 6 months and so on, to find out what's right for you and so on. It's definitely worthwhile. And you know, I think it's so wonderful to be a parent, and whether you're a parent at 35, 45, or 50, in 2014 it's doable. So don't rush it is the other thing. It's a wonderful experience. Anything else? Questions? More about our office. I mean, we're located in Norwalk, Connecticut. We have 3 other offices, one in Stamford, one in Danbury, and one in Trumbull. The other thing is I also see patients at Dr. Harry Frisch's office, which is a prominent reproductive urologist on 84th and Park. I do that once a month, so I'm happy to see people there, or happy to see people you know, in our Connecticut offices. As far as a new patient appointment, if you're in the Connecticut office, oftentimes we'll try to coordinate the necessary testing that needs to be done there, like a semen analysis and infectious disease testing. I don't know, I mean, I'm sure everybody's aware at this point, but you know, we can easily treat HIV discordant couples, or even couples that are both positive for HIV. We just actually have to make sure the semen specimen used is free of the HIV virus.